I'm a knee replacement surgeon, but 4 years ago, I had my own knee replaced. The first question out of every patient's mouth is, who did your surgery? More importantly, I'm going to give you 5 tips on how I would choose a surgeon if I were you. I'm Dr. Randall Schultz, a patient, a surgeon, and your guide. I'm a board-certified orthopedic surgeon with more than 25 years of experience specializing in hip and knee replacement. Along the way, I've had the privilege of training residents and fellows and caring for thousands of patients. I've also been on the other side of the table. I've had a knee replacement myself. This is the Surgeon Unmasked. First is, and we have to address this, online reviews. Most people are going to look at them, and I think there's some value in them, but they need to be taken with a grain of salt and with some degree of caution. This isn't the restaurant business. You're going to see sometimes reviews, quite frankly, that are completely inaccurate. Personally, I was affected by this over 10 years ago. I received a poor review on a surgery that I didn't even perform. But you also have to understand that unlike other industries in medicine, we can't directly respond to a patient review because of privacy laws. So it's a little frustrating in that regard. The other thing is, for someone to be motivated enough to put in a review, they either typically love them or they hate them. And this is medicine. Complications can occur. Even when everything is done right, everything is done perfectly. So sometimes you see a bad review because they unfortunately had a complication or a bad outcome. I think you just have to be a very careful consumer of these reviews. I would maybe look for trends. If there's a repetitive, continued pattern that you see there might be some truth there. But you got to really read through the noise and be very careful about it. The other thing is there's actually an industry that's evolved just in helping physicians, surgeons massage their online reviews. So they'll do techniques like if a bad review comes in, then go out and actively pursue 10 people to provide a positive review. So just take it with a grain of salt. Be careful which site you look on for them. I think there are some that are better than others that probably do a little bit better job of making sure these things are accurate. There's some curation that goes on at least. Along with reviews, the other thing I think you have to be careful with are these like top doctor sites, the methodologies. Some of them is not too bad, but it's hardly scientifically done. And some of them go so far as to even charge doctors to have their names on these lists. So I would be very careful in how you interpret those. I don't see them as much anymore, but for example, the magazines in the back of an airplane seat tend to be really bad. There's even an article in ProPublica that talks about how journalists actually got asked to be on the top doctor list, and they obviously wanted some money for that. So be careful in how you wouldn't probably go to a steakhouse based on the recommendation of those magazines. So I don't know that I would use that as my first resource. The other one people don't really know about is you can do a background check on your surgeon, and rarely is it going to turn up anything big. Our field is pretty well regulated. People that are doing bad things usually don't hang around for very long. But most state medical boards, including ours in Texas, have publicly searchable databases where you can see the physician's license status, any disciplinary actions that's been taken against them. Sometimes it'll show their medical malpractice history. So you can use that. There's also something called the Sunshine Act, and I think this needs to be talked about. When I started practice over 21 years ago, pretty much every joint surgeon that came into practice signed a consulting agreement. And some of those provided some value to the implant company. Some of them really not so much. It was kind of like a golfer would sign with an equipment company and play those clubs. Fortunately, that's been cleaned up. It's also now very public how much each doctor receives from industry, and it's published. I'm not saying that those who do it are illegitimate. Industry needs surgeon and physician input. But I think you just want to be careful and know that there may be some ulterior motives involved, and you just want to ask about them. And ultimately, what should be done for you is what's best for you, and ask the questions and find out. As I said, most of them are legitimate, but I think it's helpful just to kind of understand what's going on in the background. The third one is communication and trust. I think that's probably maybe one of the most important assets a surgeon or a doctor can have, is the ability to communicate with a patient and for the patient to trust them and to have their best interests in mind. When I started medical school, one of the things we learned about patient encounters and how to deal with patients and difficult patients, all these things, is to listen. And Someone did a study once that if the surgeon doesn't interrupt the patient in the first 90 to 120 seconds of the encounter, it's much more likely to be deemed a favorable encounter. So I make a point to try to just keep my mouth closed and listen. And I think that's important. I think they need to be able to explain things to you pretty clearly. And I think you need to be able to trust them. Hopefully everything goes great with your operation, but if things get a little sideways or off track, you need to know that they're going to stick with you, not bury their head in the sand. Get someone that you feel comfortable with, you can communicate with, you can trust. So really assess that. You're going to have to see the surgeon. And I'm not a huge fan of going to 4 or 5 doctor visits to shop to find who your surgeon is, but I think you'll get a feel for it pretty quickly if you can communicate with this doctor and if you can trust them. And for everybody probably has their own style of communication that may fit with you better than others. Another big one is experience and training. If there's any field that we are sort of distant cousins to, I would say it's airline, particularly commercial airline pilots. It's a highly technical field. It requires a lot of training, and we deal with stressful situations when other people's lives or well-being are at stake. I think they're a little bit probably more regulated than we are, but one of the ways that they measure their sort of tenure, their rank is by number of flight hours. And just like Malcolm Gladwell has this 10,000 hour rule to become a quote expert, I think it's very hard to become a really, really skilled surgeon without experience. And I'm not saying what that is or how much it is. And I'm not saying there's good surgeons that aren't ready to go out of training and are quite good, but it's still nice to have a breadth of experience behind you, particularly if things get off track, off course, you deal with complications, to have that experience to deal with. I mean, I will tell you this, I'm in my 22nd year now of practice, of private practice, that I'm a better surgeon than I was even 10 years ago. And at 12 years in, I was much better surgeon than I was 2 years in. So there's probably a point of diminishing returns. I don't know exactly what that is, but I would look at their experience. Along the lines of that, you should probably look at their training. Nowadays, most surgeons do a fellowship, not all, but a fellowship is an extra year of specialty training after doing 5 years of general orthopedic surgery residency. And the specialization within orthopedics has become immense. So it's really quite difficult to stay up to date and current on all the different specialties. So I would look for someone who predominantly does joint replacements or has had a fellowship in joint replacement surgery. Now, you can look me up. Mine was technically called a sports medicine fellowship, but we did 60% total joint replacements during that year. I'd also look at surgeons who have quite a bit of experience already in that particular field, and that's probably the equivalent to doing multiple fellowships. So that's something to look for. I think it also matters where they were trained, how they were trained. That's a little bit trickier. There's no U.S. News rankings that I've ever seen on orthopedic residency programs or medical schools, but generally you'll probably get a somewhat of a feel for it if you look back at their background and training. All right, and here is my secret tip, and the providers in this specialty are probably never going to talk to me again, but you can ask a lot of people. You can ask your neighbor, you can ask your primary care doctor, but if there's one specialty that I would ask, who I think probably has the greatest knowledge base of and the most unbiased opinion on who are good surgeons, are anesthesiologists. They live in the OR nonstop. They see pretty much every surgeon come through their OR, and they have a strong sense of who does a good job, who's comfortable, who's efficient. And that would be a provider that I would probably trust over any other. Now, you can ask another orthopedic surgeon. They're probably going to choose their buddy or their partner, but keep this in mind. I have almost 40 partners in this practice. I've only ever set foot in the OR and operated with maybe 5 or 6 of them. So I see their patients, their outcomes, but as far as assessing their surgical skills, I don't really have a solid foundation to even make those recommendations. The anesthesiologists are there. They see every surgery from pretty much start to finish. So now, if you don't know an anesthesiologist, you probably have a friend who knows an anesthesiologist. You may have a friend who has a friend. That old Kevin Bacon 6 degrees of separation. I'm sure if you spend enough time and work on it, but that's an incredibly valuable resource. And I think hopefully an insider tip that can help you pick your surgeon. All right. Now, everyone wants to know who did my surgery. Well, let me preface this by saying in the majority of cases, there is no reason to leave your hometown to have a primary hip or knee replacement done. Unless you live in a very small, rural, isolated area, very likely there's a very qualified, very adequate surgeon in your hometown. And I have a dozen partners who I would have been more than happy and comfortable with doing my operation. But it is for this one reason that I went out of town to do it. And that is because everyone asked me who did my surgery. Well, whoever I pick, they're obviously going to think is fantastic. And whoever I didn't pick is going to hurt them. And so that's the reason I didn't do it. I ultimately went to my mentor. He is now retired, but he's kind of a father figure to me. He's also one of the most renowned orthopedic surgeons really in the last 50 years in the United States and worldwide for that matter. I won't mention his name, but one little cool small fact that I kind of think is cool, at least, is he did his fellowship with John Charnley, Sir John Charnley, who is considered the inventor of the hip replacement, certainly, but also most people also consider him the inventor of the modern knee replacement. So I feel like I'm one generation or the grandson of the inventor of the whole procedure, but never met the man, obviously. But Sir John Charnley is the father of modern, what we call arthroplasty or joint replacement surgery. So that's why I did it. It was very nearby. It was only an hour drive for me. And I think made everyone happier and no one mad at me. And I've had a great result. One day I'll talk about techniques that he uses, that I use, that have to do with modern technology and how some of it may not be all that you think it's going to be. Please, if you don't mind, drop a comment somewhere if there's another topic you'd like to hear about. If you have any questions, I can't provide direct healthcare, direct health advice on the internet, obviously. But if there's certain topics you'd like to hear about, I'm not afraid to say anything at this point. Whatever you want to know, whatever I think about it, I don't have any horse in this race other than you having a good result and being satisfied with your joint replacement, and to help maybe kind of sort through and sift through all the information that's out there. Some of it's valid, some of it's quite frankly not. Like and subscribe. Let me know if you want to hear more. Thanks very much.